Today's program, I already had a team, and the reason for the choice of this topic was because of my statistical analysis of what I did in the month of July. I observed that 90% of the men that consulted with me in the month of July had prostate cancer, and then overall, generally, 95% of all my general consultation, both men and women. So some of those men that consulted with me had prostate cancer and had high cholesterol and had liver fats. So usually my choice of topics to discuss are based on the number of consultations that I have in a particular month. So that gives me an idea of what is happening at the moment, and then also analysis of the laboratories. I have some laboratories that I'm in partnership with. They give me reports. So I generally ask, what is the number of people who came in for high cholesterol? What's the number? Okay, what is the number of the particular test with the test that people did and that had the highest number of abnormality? We still found a lot of prostate related problems and kidney related problems and also cholesterol. So that's what formed the basis for this conversation. Please keep the chat coming in. You're welcome. Yes, if you're just joining, please let me know where you're joining from, and please let other people also join in for us, and please give us a like for this, then rate this program. Please rate it so that YouTube can recommend it for other people. So I'm just going to go straight in without much ado. We're already 12 minutes into the time. Today's seminar, we're going to be dealing with the body's defense system. I'm going to run through that, and then so from the body defense system, I'm going to go into cholesterol, and if time does not permit, I may not go into the fatty liver today, and then that can be the third Saturday from today. So not next week, the third Saturday, which is I think the 19th or so, would be that one, but you'll get more information about it. So as you can see, as you know, in case you are not okay, from Abule Egba, all right, thank you. The human body is a wonderful living precision instrument that all the parts of the body are closely related. You know, they are closely related, and the body is made up of trillions of cells. Trillions of cells. You cannot even imagine it. And they function intelligently. In fact, the smallest function of a human body is a cell. You know, and the body is just a trillion of many cells put together, and each one have their own devices. You know, the cells make up the tissues make up the organ make up the systems make up the whole body. So I'm going to run through vital systems, and I don't want you to go away. I want you to kindly get a pen and take notes. I want to do a brief introduction of myself. My name is Dr. Rita Jabin. For some of you who are coming for the first time, I'm a naturopathic doctor, and by that it means that I use natural substances to treat people. I use plants, I use fruits. You know, I graduated from the Phoenix Institute of Herbal Medicine in Arizona. I also attended the National College of Medicine in Lagos. You know, so I'm well trained, and I've been practicing for over 12 years now, and I'm also a researcher. I spend a lot of time to research into diseases and solutions into it. I'm also currently undergoing a course in public health to find out. So I want to look into diseases that may likely come up in the next 20 years. So those are the studies I'm doing now. In the next 20 years, what are the diseases? Looking at the trend of things. You know, what are the diseases that can put a strain on human health? And from that study is where I came about these topics for today. You know, so I don't want you to feel like you don't have anything to learn. You have a lot to learn. So let's explore the body's systems, the sophisticated system. The first system, so I told you the systems make up the body, right? All right, Matthew Judas from Shagamu, thank you for logging in. That's great. Immune system. Now, the immune system, most times I find that people tell me that they think that the immune system is one particular organ. No, the immune system is not a singular organ or gland. It has parts located everywhere. So the liver has immune bodies, the kidneys have immune bodies, the heart, all the organs, they all have immune bodies. But then there are the lymphatic system is more like the soldiers, the military, So even though we have state police, even though we have something like vigilante, then you now have the soldiers, you have the navy who fight the air, who fight from the sea. Then you have the air force who fights in the air, so they are deep, just like that. That's how the immune system works. So the immune system works in that way. And we have over 700 lymph nodes. Lymph nodes are like small barracks around the body, from your neck to your feet. You have lymph nodes that's why sometimes you've noticed that something can be swollen here, your armpit, your groin, they are like small barracks. Please follow me. At the end of the training, you will understand because they all layer up on each other. Then these lymph nodes, we have, like I said, like the soldier, you have the T lymphocytes. These are produced by the thymus gland in the neck. We have the B lymphocytes. Those are produced by the spleen and the lymphoid tissues. Now, the functions of this system, this immune system and this gland, is to ingest germs, viruses, malignant cells, or tumors. They kill toxic substances and neutralize them. So, if someone has any form of tumor in any part of their body, whether fibroid, whether prostate, because those are types of tumor, if first of all is an indication that there is a breach in the defense system. There is a system in the body that, if it is functioning well, it's supposed to be able to identify cells that are becoming abnormal. So it's important that you have this understanding so that it directs your daily choices of activities and things that you do. So that's the function of those cells. The second defense, so we're talking about the different defense in the body, the immune system. The second defense in the body, very importantly, is the enzyme system. Now, the enzyme systems, these are complex proteins. They are capable of inducing chemical changes in other substances. That's enzymes. Now, enzymes in the body are chemical proteins that are capable of inducing chemical changes in other substances without they themselves being changed. This enzymatic system is responsible for your breathing, from your lungs, to even digestion of food, to your bone activities. All these things, conscious or unconscious, they require the enzyme system. When somebody is having asthma, for instance, it means that the enzymic system in the lungs, there's a disturbance there. You understand? Mm-hmm. That's why it could go on for many years, because the enzyme system is an integral part of the tissues, and their function is so they have a function to help to ensure that there's proper breathing, also to ensure that they identify abnormalities and quickly calculate. You understand? So if for any reason that system is disrupted, respiratory problems can come up. People who, when rain fall, they are having catarrh, sun is shining, they are having any small thing, they are always having respiratory issues. You know, it is an indication that there's a problem with that enzymatic system in the lungs. Now, the thing is that the body has to regularly build its own enzymes. They are usually built, the body builds it. And it does not, it's not like you cannot say you are taking enzyme. Okay, come and drink one enzyme. No. The body builds its own enzyme. The body forms its own enzyme. And it does that. Remember I told you that there are complex proteins. It does that from your food, from the things you ingest. Now, but for the body to produce enzymes, the body needs catalysts. Now, catalysts are substances that are able to stimulate or cause reactions. You know, they are like what you would call a motivator. They inspire. They can cause a chemical reaction, but they themselves are not altered. I hope I'm gradually carrying you. I don't want to go too fast. Yes, please respond. Let me see your comments. I hope am I too fast? Am I clear? Are you understanding what I'm saying? Can you drop a comment in the comment section for me to know that you are here? Hello? Please drop a comment. Thank you. So I was talking about, okay, Mr. Dennis from Warri, thank you. Mr. Osamunyi Emmanuel Osifo, thank you for logging in. Thank you. I just want to be sure that you are following. Can you drop a comment in the session that you're following, that you can hear me, that you're understanding? Yes, thank you very much. Yes, thank you. Thank you so much. Okay. So I was talking about the catalysts. Now, this, my presentation today is based on some serious research. And some of them I didn't do. I have some senior colleagues who did those research. So I'm going to be referencing them because it's just proper to do. Now, researchers Dixon and Webb, they performed detailed studies into how the body builds these enzymes. You know, I'm telling you about enzymes. Enzymes are the second body defense. The first one is the immune system, which is made up of the lymph node, the lymphatic system, the B lymphocytes, the T lymphocytes. The second one is the catalyst, sorry, not catalyst, the enzymes. Now, so in this study, so we have to look at what the work of catalysts and the work of the enzymes. Now, this study showed that the body needed enzymes, but for the body to produce these enzymes, there is a very important catalyst that is required, and that catalyst is called potassium. Potassium is greatly required, and potassium is required because as we go on, you will understand what it does. Also, there is another catalyst which is also, so we have calcium and potassium, we have calcium, we have magnesium, like that, but I'm going to be focusing on potassium as a body defense. Also, it was found out that there is sodium. Sodium is an inhibitor. So catalysts like potassium does a job. Inhibitors like sodium blocks the work. You will understand that when we start talking about our diet and our food shortly. The study showed that the key function of this potassium, these enzymes, now not just potassium now, these enzymes, all the body enzymes, their main job is to recognize tumor cells as foreign cells, and meaning that they need to be eliminated. So if you notice, the first one is to identify the first one, which is the lymphocytes and the T cells. those ones are there as defense. Those ones they identify also, and they nip anything from growing. Oh, I'm too fast. Okay, thank you so much. Thank you for letting me know that I'm too fast. Thank you. All right, I'm going to slow down. So they inhibit okay, so let me slow down. They say I'm fast. The immune system, they identify tumors. They are supposed to cut the tumors before forming. Once the cells are malforming, they nip them in the bud and bring them down. The second set, which is the enzymes, those also, they also have ability to identify tumors and nip them in the bud. So this is the second defense that the body has, that has the responsibility of preventing abnormal growth in the body. Now, the study was very extensive, and it was able to identify that if the enzymes are working well, even if the immune system gets bypassed, if the enzymes are working very well, the enzymes should be able to catch abnormal cells when they are forming, or when they are formed, even bacteria and any of all that. So that's second defense system of the body. The third defense system of the body is the hormonal system. The hormonal system, I'm going to just talk briefly on that. The hormones are substances that are produced by glands, and they are released directly into the blood, and they have the job of okay, maybe I should leave that till later. Let me just go through the hormone system as a defense. So I've already told you what the hormones are, and that they are produced into the bloodstream and all that. So we have the thyroxine and the adrenaline, which regulate metabolism. Now, another function of this thyroxine is that also it regulates body temperature, including fever. And so when the body is invaded by maybe a virus, some germs, or even tumor tissues, the body responds by producing excess heat inside of the body. Excess of heat. You know, there's just a sensation of heat inside, burning heat. Usually when people experience some of these things, they initially may assume that they are having some bigger problem, you know, and may be looking for means to calm it down. So I'm mentioning to you the body's defense system. I said at first, I talked to you about the first one. I told you about the immune system. I told you about the enzyme. I've talked to you now about the hormone, and then essential organs who also have defense responsibility, like the liver, the pancreas. In fact, pancreatic enzymes also have responsibility of curbing tumor cells also. Oh, good evening, mommy. I'm happy to see you, ma. Thank you for logging in. Of curbing tumor cells. Then we have the lungs. We have, and essentially also in the lungs, I mentioned to you some enzymes there that are present, whose responsibility are to ensure that the airways, you know, there are some defense barrier in the lungs that also serve as protective coach, you know, in cases like bacteria, like tuberculosis. Those defense, they can ward off the tuberculi in a section such that the lungs can still be going on. Even in kidney, we have had people who have kidney related diseases, kidney related problems, that with this problem, the kidneys are still functioning, trying their best to function because of the defense. Open the windows. Then lastly, for the defense, we have the mineral balance. Open that side. We have the mineral balance, the defense system. The mineral balance, the human body, if you remember, I mentioned to you about catalysts that helps enzymes. And I mentioned to you that one of such catalysts, very important catalyst, is potassium. Potassium, the body needs 90% of potassium and then 10% of sodium. However, in the modern day food that people eat, that you find, canned foods, processed food, even in some water, you find a lot of sodium additives in a lot of this food. And this study by Dixon and Webb showed that when there is more sodium additives in the diet, it could cause the body to be susceptible to tumors. Now, remember, when we're talking tumors, we're talking any kind of tumor, whether it is prostate, whether it is in the uterus, anywhere tumor grows, in the breast, a cyst, whatever it is. I only just use the prostate as an example, but a tumor is an abnormal growth. A tumor is not a bacterial infection, neither is it a virus. It is an abnormal proliferation of the cells. We're going to get into that. So what is cancer? Cancer is an uncontrolled growth of cells that is derived from normal tissues. So cancer, like I said just now, it is not like a bacterial infection. It is not like something that happened from, it's not like a bacterial infection, it's not like a virus, it's not like something from outside. No, it is an uncontrolled growth of cells derived from normal tissues. Now, there are different types of abnormal uncontrolled cells that, in fact, there are different, over 200 types of cancer. But the question I want to ask this evening, that I want you to ponder on as we go on, is why is growth uncontrolled? If you remember from what I've told you about, you should be able to answer why growth is uncontrolled. What should control the growth? I already mentioned the enzymes, the defense system. I told you that one of the functions of the pancreatic enzymes is to ensure that nothing abnormal, any abnormal cell, as the cell is becoming abnormal, it just tramps it immediately. I also told you about the enzymes. They are supposed to be a detector. So when this defense, all these several layers of defense of the body, once they become compromised, what happens is that part of it, you can imagine like someone that has maybe color blindness. The person does not see color red, cannot identify color red. So anything that is red will appear like another color, blue or green, because the person has that color blindness. Whenever the color red comes, he will not notice it. So in cases of cancer, when some of these essential defenses become altered, you find out that they are not able to recognize an abnormal cell when it is forming, and then the cells are able to escape and attach themselves to some other tissues in the body, and then they begin to spread. And then there are two types of tumors. Generally, we're talking tumors. Tumors, whether it is a tumor, it is abnormally an abnormal cell. We have the benign tumor, which are tumors that are localized. They are not cancerous, but they are also growth. And because they are growth that do not belong in the body, but they are there. But all these tumors now, for instance, they are benign because they are localized in an area. They would rarely change and spread to another area. They are in one position. However, there are other types that are identified as malignant. Malignant tumors are tumors that are able to invade other tissues. And then when they invade these tissues, in that new tissue that they have invaded, they are able to also release new cells in those tissues. And those cells go into the bloodstream, they circulate round and set up new colonies, and these are known as metastasis. So they grow into other tissues. They move from one cell, move to other cell, and then they form a tissue, and in due course, they begin to cause havoc on the body generally. So, like I've told you from the beginning, I said cancer cannot occur in a normal, in an ideal setting. Cancer should not occur, because all the defense mechanism, from the immune to the enzyme to the hormones to the minerals to the essential organs. For instance, in the prostate, there are some defense in the prostate that should be able to identify when a cell is becoming abnormal. But if for any reason, maybe because of infections that are not properly treated, because of calcification, because of poor hygiene, because of whatever reason, it could even be genetic, hereditary, it could also be in drugs. Several factors can contribute. We'll get into that can contribute to all this, can make the body, that organ, not the defense within that organ, to be at a lapse. And then an abnormal cell forms, an abnormal cell grows, an abnormal cell is able to hide itself, put a code on top of itself, and attach to a lymph tissue, a lymph node, and then the lymph node carries it and it spreads around the body. Now let me talk to you about prostate cancer. I'm using prostate as a case study. So when I'm saying prostate, think the same principle is what applies in breast, is what applies in any other part, because I want to keep the class not too everywhere, so that you can get the most from it. So now, cancer of the prostate is a cancer that originates from the prostate gland. Cancer of the breast is a cancer that originates from the breast. Cancer of the uterus is a cancer that originates from the uterus. Cancer of the bone marrow is a cancer that originates from the bone marrow. So you see, wherever organ, whichever part it is, the cancer originates from, it bears the name after it. Let me just talk briefly about the prostate gland. It's only men that have prostates, by the way. Women don't have prostates, only men. Thank you. Men don't have uterus, only women. So, and because I've done a lot of videos on women, this may be like my first video on talking about men. That's why I decided to do this. So that, because the men have been accusing me that I'm being feminist. It's only women matter I'm talking about. I'm not talking men matter. So that's why I'm here today. So the prostate is a gland of the male reproductive system. A healthy adult prostate should weigh around 20 to 25 grams. And usually when you go to do scan, these are the perimeters that are measured. And is about 4 cm wide, 3 cm high, 2 cm thick. It is a dense fibromusculous tissue gland, and it has a shape like a cone that is inverted, like an inverted cone. It is located in front of the rectum and at the neck of the bladder. So it is just by the neck of the bladder. It surrounds the urethra. And that's why when there's a problem with the prostate, man finds it difficult to urinate. One of the functions, or the key functions of the prostate gland, is to produce white milky discharge, which nourishes the sperm, and it forms a part of the semen. I think about 35 to 40% of the semen is made of the prostate juice, plus prostate fluid rather. Now, when there's an uncontrolled growth of the cells within the prostate gland, it could give rise to cancer. There are different types. Somebody can have a benign prostate hyperplasia. That means that there's an abnormal growth of the cells that have formed some form of calcification. It now makes a fibrous tissue to become a bit hardened, within the prostate gland. That can be benign prostate hyperplasia. Then it could now degenerate further and become cancerous when it has the ability to spread to other locations like the bladder, like the rectum, and so on and so forth. Normally, cells divide. That's how cells reproduce, and cell health manages themselves. They break normally. But in a case of an abnormality, when a cell is breaking more than normal, not following the normal cycle, not following the normal pattern, then you find out that it becomes hyperplasic, or it could become cancerous. Now, what are the things that causes abnormal growth? Now, this abnormal growth can mean abnormal growth in the breast, abnormal growth anywhere, remember. So that's why I said, don't say that, oh, it's from prostate, I don't have prostate. It is prostate I'm using as a, but it is the same thing. Thank you for being online. Thank you. So I was talking to you about the causes of abnormal growth, like cancer. So any form of cancer, whether it's been cancer of the bone, whatever, these are some of the causes. May not be all, but some of them. Drug misuse, drug abuse, Then we have food additives. If you remember, I told you that sodium is an inhibitor, and a lot of the food that is made, please, are you there? Are you there, please? Okay. All right. Please, I need your comments. Your comment helps me to know that you are there. I'm looking at all manner of devices. If you can see the devices in my front, more than 3 computers right now I'm using to check. All right, thank you. Okay, thank you. Okay. All right, so let me go on quickly. Thank you for your time. Thank you. All right, you can hear me. Thank you so much. Cynthia, Edwin, thank you. Okay. Thank you. All right. So drug misuse, drug abuse, antibiotics misuse, pain relief. Oh, praise God. They have brought light. After going through all the stress, but I will still go on, So, so drug misuse, drug abuse, food additives. I talked about canned foods. If you remember, I said canned foods have sodium has. Thank you. Sodium is an inhibitor. And sodium causes retention of fluid in the body. Because it's an inhibitor, one of the ways that the body reduces the toxicity that sodium comes with is that it causes the body now compensates by causing fluid to be retained in the body. So for the fluid to be retained in the body, you now experience, that's when some people tell you that they experience swellings, So that's for that. Then we have altered foods. Altered foods are foods that have been genetically modified. They are honeys that are being formed in the lab without a bee. There are meats that are made from, all these chemically altered foods. They cause abnormal growth cell. They cause abnormal cell proliferation, uncontrolled cell division, uncontrolled cell activity, anything that causes uncontrolled cell in the body. In cases of leukemia, I'm even seeing it, also in the cases of leukemia, all these things, there's an abnormal control. There is a breach in the defense. You understand? It's just that if it affects, there are different, like I told you, there are different types of cancer. Maybe on another day we would go into all those nitty-gritties so that we can get the most of this. That's why I'm just keeping within the
guide. But these things I'm saying, they apply to everything because it's a principle. And this is one of the principles that I apply in my treatment for cancer. This knowledge is what helps us. So far we have achieved tremendous results because of this principle. And this is what I'm teaching people, because oftentimes people come and they are coming with some symptoms of some things, and they come with it, and I'm explaining to them, and they are looking like, this thing you are saying is based on studies. It's the truth. It's you can verify. I have told you some names of 2 researchers that have done extensive work, very serious extensive work. It's just that their work may not be available free of charge, because some of all these researches you have to pay, but if you are a part of a research institution, a research body, you will find that you can get access to some of these information that I'm sharing with you right now. Also, fluoride. You have fluoride that can cause abnormal cell growth. You have nicotine, you have alcohol. I'm mentioning things that can cause abnormal growth in any part of the body. Then we have cosmetics. Cosmetics, a lot of the things we put on our body, they are made up of chemicals, and these chemicals, when anything you rub as cream, as soap, as perspirant, as perfume, they go straight. Your skin is a sponge, so anything you do penetrates through the skin into the tissues. They go straight into the liver, so there are sometimes some people want to be yellow, some people want to look somehow, they rub some things. These things, we're talking about what are the things that causes abnormal cell activity. Abnormal cell activity. These abnormalities that we're talking about, these things that cause abnormal cell activities, you spray these things, you use these things. Some people go to do some therapies where they will infuse them. You are infusing yourself with something that your body needs in trace elements. It doesn't require it so much. You go for some vitamin infusion, these things have the potential, the high risk of causing the body's defenses. The lymphocyte, the T lymphocyte, the B lymphocyte, they may not be able to identify abnormal cells because of these things. Please just give me 2 minutes. We want to switch, please. I'll just be back shortly. So cosmetics, these are things that causes abnormal growth, abnormal cell growth in the body. Also, aluminum toxicity. In fact, I've done a video on aluminum toxicity. I think it's on this page, or maybe it was not made open, but I'm going to instruct that it should be made open so that you can. I think it's there. There's a live video that was done. Aluminum toxicity is, if you finish watching, if you can watch that video, I talked about the dangers of aluminum. I talked about the effect of aluminum on your body. I talked about how it can cross the brain cells and cause break barriers and cause symptoms like headaches, migraine headaches, dizziness. Aluminum toxicity. This aluminum is one of the most abundant mineral elements available on earth. Everywhere there's aluminum. But because it's abundant, your body doesn't require it so much. And when you're exposed to many sources of it, like an average perspirant has aluminum in it. Several other cosmetic products have aluminum used as a binding agent, used as something you use aluminum for to cook. All your bread is made with aluminum pan, your cakes are made, your cookies are made, aluminum toxicity. So I've talked about aluminum toxicity as something that causes abnormal growth. Then electromagnetic fields. Electromagnetic fields, there are lots of studies right now that have shown that being close to the mass, radiations from your phone, radiation from the environment, they can cause the cells to abnormal. Then frequent use of radiation therapies for diagnostics like MRI, X-ray, if you are always having to run several of all these tests, they have a tendency. They said no audio. Really? No audio? Can you hear me, please? Madam Tony, are you sure it's not from your side? I just want to be sure that you can hear me. Please, can someone else hear me? Is she the only one that has audio problem? Please. Are you sure you know? Please, I need to be sure that. I can hear myself very well. Can you hear me now? Yes, I'm loud and clear. I'm sure it's from your side. Yeah, I'm sure. Okay, he said they can. So electromagnetic fields. I need to go on. The audio is not coming out. Then lastly, we have okay, thank you. You can hear clear. Thank you so much. So lastly, the enemy within stress management. Remember, we're talking about things that can cause general abnormality, abnormal cell growth. So these things I've told you things that cause across everybody, not just prostate, So you need to be, what do I need you to do? You need to be more intentional. You cannot afford not to pay attention to your, to the things that you are doing, to the things you are eating, to the things that, the contents. Remember, knowing that sodium is, some people will say, I don't eat salt. You don't eat salt, but the things that contain salt are in the things that you are eating. If you add it every day, it's a lot. And that's one of the reasons high blood pressure is one of the most challenging things to treat, because while the body is trying to get rid of sodium, people ingest a lot of sodium and take less of potassium containing food. So these things are important. The balance is needed. When there is no balance, abnormal cell growth, abnormal cell activities takes place. Now let me go into the symptoms of prostate cancer. One of the classical signs of prostate cancer, or that the prostate condition is becoming cancerous, is blood in the semen. If you notice that there is blood in your semen when you ejaculate, it's not something that you should ignore. We need to do proper investigation. Now, not all cases have that, but most of the cases have that. Then there is blood in the urine. Blood in the urine may not necessarily mean cancer. It could be from the kidneys also. It could be from the bladder, and it could be, there are several other things, but blood in the semen when you ejaculate, that is a classic sign that needs, it's not something you see and go and be drinking something on the internet. You need to immediately get on a consultation. You need to immediately get on some serious analysis to do investigation, because the earlier you investigate, the better for you, and the better your chances of quicker recovery. Also, back pain, pain in the thigh, incontinence, urgency, leak of urine, burning sensation. Now, those symptoms also happen in the case of prostatitis. But in the case where
are cancer cells forming, then blood in the semen is a classic. You know, there are some things we call classic sign. That classic sign means that it is a strong indication that something is like this is already brewing. It may not have manifested, it may not even be showing on your PSA, but it's not something that you should take lightly. You know? So, alright, thank you. It's very loud now, alright, thank you. So, what are the tests that you should do? So, in this particular session that I'm having, I'm going to tell you the problem. I'm going to tell you the tests that you should do so that you can take action. You cannot say you didn't know anymore because now you know. Are we still live? This thing is rolling. Okay. Test to do. Prostate specific antigen known as PSA. Usual normal range is between 0 to 4. Anything above 4 may be considered abnormal. May not be cancerous, but may be an indication that there's a problem because the antigen level in the blood, remember you are measuring it, and when they are more than normal within the blood, then it's an indication that cells are beginning to behave abnormally. We have the liver function test. Because of the direct, when we get into the liver, you will understand the role of the liver in a lot of all the other glands and their functions. So when there's an abnormality, the liver function test may pick, it may be easy, you know, and then if there's an abnormality in the functioning of the liver, it may also affect the gland. So a liver function test and ESR, you know, before something will become full-blown problem. Remember I told you about the body defense system. The liver is one of the body defense system. The hormone is another defense system. The enzymes are defense systems. Minerals are defense systems. The immune bodies are defense systems. Now, ESR is a test that everyone should do every 6 months. It is a test that checks. It's a test that you do from your blood. That test usually would indicate that there is an inflammatory activity taking place in the body. Oftentimes people come to me with some problem with their bones, problem with any part of the body, irrespective of the part of the body that they have that problem. They now come and they're having this problem, they've been treating it, they've been going here, doing this, it's not getting well. And I asked them to do an ESR. Some people have as high as 70 something. I know that there is a problem. The inflammation in the body is very high. That shows that something. Remember that the body is made up of cells. Cells. You are a giant cell. Cells will make up tissues. Tissues will make up organs. Organs will make up systems. Even glands are made up of tissues. You understand? So, at cellular, before it begins to show in the gland, remember that abnormal growth in the body comes up from when the cell begins to there's no control. It's like your street lights. Your street light is showing green. And when it's supposed to show red, it's showing green. There will be accidents. There will be mishap. ESR is a test that can help you to know whether you're having inflammation. It's not a very expensive test, but it's not a common test that people do. It's a test that will help you to know what is happening within your cells. Usually, it doesn't point to any particular kind of inflammatory activity, but it is just a general. It will always show you a general it will show generally that some cells are abnormal, some cells are behaving abnormally. It is from there that we now begin to find out, plus the complaints you have, plus the symptoms you are manifesting, then plus the result of the ESR that can now help us to now narrow down to which place is this, which barracks
Remember I told you that there are over 700 barracks of lymph nodes across the body that have functions to detect. So when there's an abnormality, immediately the cells know it and they show in the red, they show in your blood. So ESR is a test for you to do. Whether it is for the breast, it will show. Whether it is in the blood, it will show. Whether it is in the bone, it will show. Anywhere it is, as long as there's an inflammatory activity, it will show. Anything that causes roughly, it will show. I'm telling you, it will show. I hope I'm communicating. I hope you are learning something. I hope it's making so much sense to you. I hope. A prostate scan. So suppose it is breast, for instance. You want to go and do a breast scan. So instead of doing a prostate scan, you do a breast scan. You see? You will still do a liver function test. You will still do an ESR. It's just that there are several other tests that you may now have to do, an hormonal assay, and all that. You understand? But the organ that is in question should be checked. And sometimes a scan will show you. It will show you. Someone sent me a test result. And the test already showed me that the glandular tissue in that organ was already, it had not been, the report said query. It was like, there's a possibility that this is cancer. But the person is alright. And the PSA is normal. This particular person, the PSA was normal. But like I said, the symptom was classic. So he went to do that prostate scan. And then the scan showed us, showed some dimensions and showed some other details. I don't want to share details of what it showed, but it will if you go to a good scan, it will always show you. Then you now add an ESR to it that is high, and then now check the liver function. Sometimes also you could do an abdominal pelvic scan. An abdominal pelvic scan is always advisable because an abdominal pelvic scan will just show you all the organs in the abdominal region as well as the kidneys at the back. So it will show you your liver, it will show you your kidney, your pancreas, show you your bile duct, show you your stomach, it will show you the intestine, it will show, if a woman, it will show your uterus, it will show your ovaries, it will show, it may not be very detailed as if you went to do an ovarian scan, but at least to give an overview, it's usually, in fact, one of the ways some women detect that they have pelvic inflammatory diseases or infection is from those simple scans. So a simple scan, ESR is the name of the test. Go to the lab, they'll tell you. So what should you do in cases like this? With this information that you have had, maybe you are even diagnosed. Maybe you have some symptoms and you were not paying attention to it. I would advise, honestly, book a consultation session. What would a consultation do? It will provide lifestyle assessment, it will provide nutritional assessment, it will provide health assessment. Health assessment is very important because there's no condition that treating is cheaper than preventing. And like I'm giving you information today, in the course of consultation, you get to know for yourself some things or you get to share some things that you didn't even know were a problem, and then you take advantage of it. So that's something that you should do. Number 2, you need to work at prevention. Prevention is always better than to treat. But the prostate, you need to prevent. Then also, you need to cut drastically on sodium containing food. Sodium containing food. I'm not even saying don't add salt to your diet, but ensure that you are intentional in your decision, intentional in your choices, intentional. You have to make intentional choice. You cannot throw caution to the wind. This is not the time you just go and buy any toothpaste. You see, you have to be sure what you are putting in your mouth. You have to be sure because you see, a one-time thing is not the problem. The problem is the accumulation over the years, over the time. That's where the problem is. So you need to increase your potassium in your diet. Food like sweet potato is very rich in potassium. It's very rich. I always encourage you to have a lot of sweet potato. Now, sweet potato is not going to cure you of prostate hyperplasia or prostate cancer or prostate disease or issues. If you're having prostate issue, book a consultation. Get yourself assessed, do tests. If you want to prevent any form of growth or anything, sweet potato, and when I'm talking to people, I'm saying most likely the deep purple colored one, or what people call the red one, that one that is very deep, dark color, very good, so you can get that. At the end of the presentation, I'm going to give a home remedy of something that you can do, but I need to run along now to the next thing. Then also too, I must say before I move on to the next thing, in order to prevent, I've had quite a number of patients come to me for prostate related issues, which I told is one of the reasons for which I came up with this topic, to even educate you on the dynamics of how things become abnormal. It's not that it's not compulsory that when you are 60 years you will have prostate issue. You don't have to have it. But if you have had a family history of someone who has had it, then you need to pay attention. And I can tell you, my dear brothers who are listening to me, or sisters who have brothers who are listening to me, you should get our prostate tea. Our prostate tea is very good. It puts into consideration all these things, and they go to help the tissues in the prostate gland to regain themselves back and take control. Well, of course, if someone is cancerous, there is another protocol. I told you about the cancer protocol, but generally, to care for your prostate, to manage a prostate hyperplasia, prostatitis, prostate-related issues and symptoms, get the prostate tea. It's always better to prevent than to even cure, to be looking for cure. So let me move to the next topic, which concerns everybody, and that is cholesterol. Cholesterol is a waxy substance found among the lipid, which is fat, in the bloodstream. It may interest you to know that 60%, your body produces 1 gram of cholesterol every day. Your body produces it. That is minus the one that you eat. But the one your body utilizes per day is less than 400 milligrams. So you have 600 that is in circulation. You see, your liver, so 60% of that 100% that your body produces is produced primarily by the liver. Your liver produces 60% of cholesterol. That's why when people are having cholesterol issues, I always laugh. My cholesterol, by the way, this month of August, I decided to do a special, because of what I found out with the July, a lot of people having cholesterol. I decided to do a special discount for the cholesterol tea just for the month of August. You can get it at almost 25% subsidized, so you can make an order, drop your numbers on the group, and then you'll be reached, for the cholesterol tea. Now, you're going to understand why I mentioned that to you as we go on. 20% is formed from your intestine, and then the remaining 20% your body gets from the food that you eat, and then from other organs. Now, cholesterol itself is very needed in the body for the functioning of your body. Remember that one of the defense of the body is the hormones. Good. It's the hormones. Cholesterol is responsible for production of hormones. Hormones. The glands produce hormones. Cholesterol. If there is no cholesterol, if your cholesterol levels are imbalanced, your hormonal chances are that your hormonal levels will be imbalanced. Because hormonal assay is an expensive test, people don't often do it. But it's good for you to do a hormonal assay. It helps to check all your hormones as they are produced by the glands. Sometimes when you go, they'll say, which one do you want to check? Because when people are concerned about giving birth, they're checking for the luteinizing hormone, the follicle stimulating hormone, and all of that. But there are several hormones. If you want to do a complete hormonal profile, it costs money, but it's worth it. It will show you everything. Cholesterol is needed for very key functions such as production of hormones, including sex hormones, corticosteroids, and the production of vitamin D. So when people say, I don't want to have cholesterol, is because when I hear them say that, I know that it's because they are not aware of, okay, is cancer genetic? Cancer can, remember that abnormal cells. I told you about the abnormal cells. Let me just quickly answer. I'll answer all the questions at the end. I'll answer all the questions. Just keep them coming in. So, but cancer is not contagious. No, it's not contagious. So I was talking about people wanting to, oh man, I lost my train of thought. Let me just flip over. What was I saying? Okay, so cholesterol responsible for building hormones, vitamin D was the last thing I said. Now there are types of cholesterol. When we're talking cholesterol, we're talking the lipid, body lipid, fats, the fats in the body. There are primarily 4 types of cholesterol, although there are different sub-other types. We have 4 types, major types. We have the very low density lipoprotein. They are very low density. You have the low density lipoprotein. Low density lipoprotein is the bad cholesterol that causes plenty problem in the body. You have the intermediate density lipoprotein, and you have the high density lipoprotein, which does the work of trying to correct the work of the low density lipoprotein. The low density lipoprotein is considered harmful because, why are they considered harmful? Why? Those ones that are very low density, intermediately low density, and the high density, those ones don't easily deposit on the walls of the arteries. Remember that cholesterol is a waxy, yellowish substance. Wax is found in the blood. So these low density lipoprotein it is easy for them to gum the walls of the arteries and form plaques. Now, when they form plaques, they reduce the lumen. So suppose this is how it's supposed to be. When cholesterol is loaded, it can begin to reduce and reduce and reduce, so that the space for blood to pass through is reduced, increasing the pressure that it takes for blood to pass. So these plaques that are formed on the walls of the arteries, they reduce the arterial blood flow, and it's rough, and it allows, when the platelets, remember that the work of the platelet is another type of blood molecule that has defense responsibilities, and those are a bit bigger than the normal sizes, the normal small red blood cells. Now, when you have a reduced lumen, what happens is that the platelets would easily accumulate, they cannot pass. So platelets will now, something is hooking it to just be there. Before you know, over a period of time, clots will now form, which can block a part of the body. Most times, usually the legs. You have people, they have blood clots, they have problems with circulation to their legs because the arteries have been reduced the flow of blood reduces because of arterial, a condition known as arteriosclerosis emerges. I'm trying as much as possible to bring plenty grammar. So that's why I'm, instead of calling grammar, trying to explain what I'm trying to say. What the condition known as arteriosclerosis comes, and this can occur in any of the vessels. If it happens in the vessels, in the heart, in the coronary, if they go and eat the same thing, because the same arteries everywhere that carries blood around the body, if they happen around the heart, what happens is that it now causes the narrowing of blood in the coronary artery of the heart. Then it will cause symptoms like chest pain, serious chest pain, because not enough blood. A part of the body may begin to die because not enough oxygen, not enough blood gets in there, means not enough oxygen is getting there, meaning not enough waste is removed from that part of the body. So you understand? And then it could easily cause a stroke. So HDL is much more better
And I'm going to tell you some of the sources of LDL and some of the sources of HDL. What are the facts that you need to know about cholesterol? One thing that you need to know about cholesterol is that most ingested cholesterol, they esterify. That means that they form. And when they are formed like that, they form because they are waxy. It now causes it to be poorly absorbed in the guts, by the guts, that's intestine. So the body compensates for this absorption of ingested cholesterol by reducing its own synthesis. So that means that, what am I trying to say to you? One of the facts is that when you eat food, the first 3 to 7 hours of eating food is when the intestines are able to quickly just metabolize and digest the fatty part of the food. After 7 hours, absorption is slow because of the wax that forms around the. I wish I was doing a demonstration. The waxy substance that it now forms like a paste around on the intestine. Forms like a paste, so it's not digested properly. And so, what am I saying with this? I'm saying that the best time. That's why the best time to eat food that are high in fats, high rich in fat, is either as breakfast or as lunch, or not as dinner. Not as dinner, because your body is not, after when you stay there, your body is not digesting it. It will just be there, and then it will not. Your body will not pass it out. Your body will reabsorb it again. So there's a process of the when we get to fatty liver, you understand. This cholesterol from the one that you eat or from the one that the body produces, when it's not properly digested because of maybe the time of eating, because of the quantity of eating, because of several other factors, the body has what we call reverse osmosis, where the one that's not used, the body will take it back and go and store it in the liver and go and store it in the bloodstream. The body goes back, just takes it back to go and store. So fact number two is that plants make very small cholesterol. What plants produce it? Phytosterol. Plants produce cholesterol. So when I tell people that we have very small source, the source of cholesterol is very, very small in plant, very, very small. And there are very few fruits that even have some form of that small quantity. It's not every plant that has. But what plant has is phytosterol. And this is a similar substance like cholesterol. And then it's able to compete with cholesterol in the intestine for reabsorption in the intestinal tract. So when you eat a lot of plant diets, your body is able to better absorb it than when you eat animal diet, because of the way that animal diet, the components, I don't want to go into the chemistry of all these things, because of the way it is, because the chemical, so that phytosterol is easy, so the body easily absorbs it. And so when the body absorbs it, it's also able to excrete the molecules. You understand? So when you spend a lot, and then when the body is excreting those molecules, some of the cholesterol molecules that are present also have the cause of the body in excreting, it can also pull off some of those ones and they go out, from the body. So what am I saying in essence? I'm saying that when you say, well, people tell me or people say to me that, I don't want to eat this thing because it's high in cholesterol. And I tell them, plants don't give you cholesterol. It's animal that is giving. Your milk is where your cholesterol, your eggs, your liver, your pomo, your shaki, your iron, All those things, they are the ones that are giving. It's not, they are not. So it's not, that's not what is giving you high cholesterol, because plants by themselves have phytosterol and they are easily to absorb in the gut. Let's move on. So foods that are high in cholesterol, very high, major direct sources of cholesterol: animal, cow. You see how big cow is now? Cow, any animal, not just cow, any animal. Fish gone has cholesterol. It's just that they vary in quantities. Some have more of low density, some have more of high density. So I'm just going to mention some of the things that are very rich in low density lipoproteins that can cause problem. You have your red meat, your eggs, whether it's the yolk or the white, it's rich in cholesterol. Your liver, your kidney, your fish oil, butter, because butter is made from animal. It's not made from plants, made from animals. So whether margarine, whether butter, whether whatever it is, then your steaks, your hot dog, your cheese, your milk, these things are very rich in low density properties. So when people ask me, can I drink skim milk? Can I eat it? How am I going to explain this? Holy Spirit, help me. When the thing is made, it is made up of that is the component of that thing. So it is the composition of these things I'm saying is that they are very low, they esterify. You don't understand? So it doesn't matter whether it is skim milk, whether it is this one milk, whether it is goat milk, it has it. Do you understand what I'm saying? So for that reason, you need to apply some tax. Fact number 3 is this: biosynthesis of cholesterol is directly regulated by like I told you, homeostatic mechanisms. So I'm saying this because there's a patient of mine whom I told eat food, and the person said, I don't want to eat, I don't want to increase the cholesterol. And I told her, I said, if you don't eat, your body will produce much more than necessary. Much more than necessary, because when you are eating, so the fact is that a higher intake of food that are high in phytosterol leads to a net decrease in the endogenous production of the body producing cholesterol. Whereas a reduction in taking foods high in phytosterol will cause the body to produce more. Remember that phytosterol competes with cholesterol in the intestine. Your body would prefer to take phytosterol because it's natural. Do you understand? It's easier than the waxy chemical substance called cholesterol. You understand what I'm saying? So, and your body will produce because your body needs it to serve other functions. But if your dietary pattern is not balanced, you now have a situation where, because you are not having food, you are not eating, you are doing weight loss, you are eating once a day, your body will produce it. You are not eating, you eat plenty, you eat your food in the night, so you need to change the timing for which you eat your food. Your most heaviest meal of the day, maybe like maximum 2-3 o'clock, you should have it. Your heaviest meal in the day. End your day with plenty of vegetables. Start your day with plenty of fruits and fibers. These things are very, very important. When we get into the liver, we're going to go into that. Now, what are the symptoms of high cholesterol? Honestly, there are no symptoms. That's why most times, are you there? Can you hear me? Am I making sense? Am I communicating? Like to know? No sign. Most times there's no sign at all. The person doesn't know that he has high level of cholesterol. And don't be deceived by saying that you are very slim. 3 people went to do laboratory tests. So I went to visit a friend of mine in Lagos and we got talking. And I said, why don't you go and do your test? Why don't you go do tests? So I sent them to do some tests. One of them was very big in size.
Another one was not very big. The one was speculate in size. These are people who are above 50 years of age. So the one that was very checked, said, I'm very, I don't have high cholesterol. I was not saying that, you'll be surprised that your cholesterol is very high. She said, no, it's not possible. So we went ahead and they did the test. To our amazement, the one that looked like, very, very small, tiny woman, like lady like this, the one that looked like that, her cholesterol and LDL was 300 and something. All three of them had high cholesterol anyway, but that one had much higher cholesterol. You know why? When she gets to where they are, she say, see me now, see after I small like this, make I chop, make I get body, make I chop, let the food enter my body. They were piling up in the arteries. Why are there no symptoms? There are no symptoms because the first place where they will store is inside the arteries. It's when the arteries are now full, they are now very full, they begin to manifest symptoms. So when the person is already having arteriosclerosis, the person is already having so much of it stored in the liver as a backup, then the person is now manifesting signs like headaches. Headaches because not enough blood is getting to the brain anymore. Dizziness. Then at some point, the person may begin to find some yellow spots, yellowish spots on their skin. Sometimes they are stool also. Then the person may begin to experience palpitation. The person may begin to experience difficulty in breathing. The person may have high blood pressure. The person may have heart problems, and the person may come down to stroke. So the first thing with high cholesterol is that there's no sign. And that's why it's a danger. And that's why that's why I'm educating you today. Have you checked your lipid profile? So people say, what do I do? You go and do a full lipid profile, fasting lipid profile. You take the blood specimen before you eat food in the morning. So you go and do a fasting lipid profile. And that's why I told you that our cholesterol T is rich with this phytosterol. We have laboratory evidence in the formulation of it. It was a deliberate plan to ensure that the plants that were put together, by the way, 15 plants were put together. The plants were put together to be able to have direct effect on the blood. And I'm telling you, if you use the cholesterol, before you use it, go and do tests. When you finish using it, you go back and do your test. You will see the changes. Laboratory results is the evidence that it works. Nothing more. It's not I feel good. For a condition like cholesterol that someone does not have symptoms, or symptoms don't show on time. The person may be feeling alright, but the person is a time-ticking bomb. So you see, the person should go do the test, get the cholesterol T, and what are the tests that you should do? I'm going to tell you. If you want concern about your lipid profile, full fasting lipid profile, just tell them you want to do FLP. You just go to the lab, FLP. If you go to a lab, all these tests I'm calling, they are not strange tests. Go to a lab. They know it. They will tell you what to do. A liver function test. Liver function test because you want to see the liver produces cholesterol. So the liver will be a great indication beyond your blood test to tell you. And then an abdominal scan, a scan of the liver will show you the different section of the liver. It will show you if it's becoming fatty. That means that there's a return that is not yet showing in the bloodstream. And ESR is also good because to tell you if there's an inflammation. Remember that sometimes there are no tests, there are no symptoms. If you don't experience any symptom, no symptom at all. There's no symptom. For high cholesterol, most times, no symptoms. And sometimes some people have come to me with heart-related issues, and you look at it that how did the heart become damaged? How did the ventricles could be damaged, the atrium could be damaged, they could have ventricular hyperplasia, they could have ventricular atrophy, they could have different types of, depending on the part of the heart that is being affected and what is being affected. Sometimes, not in all the cases, but most of the times, imbalance in cholesterol, in this lipid. Now, let's just take cholesterol because I've told you that there are different types. Imbalance in the lipid. Sometimes someone could have very low of the good ones. The good one is a check. Remember that I told you that from the beginning, if you were here, I told you how that the body has defense. And when there is an imbalance, it means that a defense has been breached. So even in this lipid, in the cholesterol now, there is something that is supposed to balance it. It's supposed to, the work of it, the main regulatory mechanism in sensing of intracellular cholesterol in the endoplasmic reticulum is by the protein sterol regulatory element binding protein 1 and 2. I told you I don't want to be calling plenty grammar to you so that it will be enjoyable to you, but I know what I'm saying. This is a sensor inside the cells. Anything that causes this sensor, the way your car has sensor. When the sensors are working from the dashboard to tell you check oil, when the sensors are working to tell you brake fluid, when it to tell you tire pressure, when the sensors are not working, your car will just knock engine. The sensors are supposed to detect in the engine when there's a problem to show you check engine sign. But when the check engine sign is there, you did not do anything to it, you don't need the check engine sign. What happens? One day, they say the engine short oil, or one thing happened, or one thing, you knock engine, or brake, gasket burn, there was no water, gasket now burn. There was supposed to be a sensor that was set up whose job is to detect before it gets to danger and possibly cause a shutdown. So if there's a balance, so when I was talking about cancer, I told you, I said, when there is a breach in the defense, anything can happen. The same thing with cholesterol. When this steroid regulatory elements, this protein 1 and 2, they are called SREEP. When for whatever reason causes them not to be able to detect, you can have very high level of the very low density lipoprotein, and then very high level of the low density lipoprotein, and very low level of the high density. The high density lipoprotein should be within normal range, because when it is within normal range, it serves to checkmate the work and try to reduce the effect of the plaques that are forming in the arteries. So your body, the way God designed your body was designed to help and heal itself. And that's why when my patient comes to me, I always want to make sure that the things that they are taking, the things I'm giving to them, are things that would go and resuscitate those sensors. If those sensors are working well, they can trigger the body to say, get to action, do this, do that. And when the body does it, the body recovers from it. The body takes a hold of it. The body becomes more at alert and more sensitive. I've had people say that when they are on my medication, the things they used to take before, if they take it and their body cannot tolerate it. I say yes. Because that time when you go and sit down drinking beer and your body is not doing anything, or all these things, they tend to reduce the sensitivity, the sensitivity. They have long-term effects. They reduce the sensitivity. So a patient comes to me, used to smoke, we do lung therapy for the patient, and then the patient now thinks that he can go. When he went back to go and start smoking, he cough. I said, oh, madam, okay, your body will not be able to stand where they smoke. Any kind of thing that will become a problem, the enzymes in the lungs become at alert. That's what my therapy does for you. That's what the teas will do for you. The teas they are very well put together with this knowledge in mind, was what they were used to from it. So this month of August, I told you, the box of cholesterol tea before, it's not before, it goes for 25,000. But for just this month of August, it's just going to go for 10,000 naira. And that is because of the number of cholesterol and fatty liver that I had to treat in the month of July. became very alarming. Very, very alarming to me. Almost everybody that came to me with, in addition to the problem they had, high cholesterol was, like an icing of the problem. So somebody comes with cancer, he has high cholesterol, join it. Somebody comes with liver hepatitis or liver. I had a case of liver cirrhosis. He had high cholesterol, join it. Somebody came with kidney problem, he had high cholesterol, join it. Somebody came with heart condition, had high cholesterol, join it. Somebody is trying to conceive, had high cholesterol, join it. High cholesterol was like an handbag that every case that came to me had. And I'm wondering, what's with this high cholesterol? What's with this thing? So let me give people knowledge. A lot of effort was spent to get people to be on this program so that they will hear and understand these things about the body defense. Once your body defense is in its full scale, full ability, it will do its work. You just need to supply it with food. When you eat well, eat right, I tell you, your body will get. You don't need to do supplements. Another day, when I go live another day, I'm going to tell you the dangers of supplementation. Part of these things are things that causes alteration in the sensors. So don't tell me what of vitamin B, what of vitamin C, go and eat it in fruit. I did a live webinar and I shared with people A to Z, vitamins A to Z. That webinar is not free like this one. That one was done free, but the subsequent of it is not free. We just, I think 10,000 you get the full videos. You listen to vitamin A to Z, the things you should eat to give you the different vitamins and the symptoms of it. You take it and use it. So these things are very, 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 very important for you to be well. So what should you do? You should ensure in maintaining your cholesterol levels, in preventing abnormal levels of cholesterol, in ensuring that your body does not, your sensors are working well, whether your immune system, your enzymes, your hormones, your minerals, your essential organs like your liver, your pancreas. You see the order in which I'm listing them for you. That is the order in which they are, the order of the defense that these organs have. The liver, the pancreas, the lungs, the spleen, the heart, the brain. No, sorry, the liver, the spleen, the kidney. Yes, kidney. The liver, spleen, kidney, liver, pancreas, not spleen, liver, pancreas, kidney, spleen. Now, in terms of defense, so I'm not talking in terms of function, defense, that is organs that have defense against abnormal tumor formation, abnormal cell formation, that have active their immune body's immune system, their enzymes also work generally in the body. Generally also to provide, aside from the white blood cells, the immune system, aside from those ones, these organs also have like special squad who are at alert to be sure that nothing is going wrong. What do these organs need? They need you to just eat food. They just need you to just eat food, eat plants. If you can eat one cooked food a day and have more of fruits and vegetables, and by fruits, I'm not talking smoothies, I'm talking like, you just eat the whole fruit. Eat pineapple, eat watermelon, eat them, eat plenty of fruits. Eat them. Take 5-6 fruits together, put them together in a bowl, eat them. Don't juice them. Eat it. Chop them into small bits. Eat. Then you can have your main heavy meal of cooked food, as your lunch. And then you have vegetables as dinner. Make this a lifestyle. When you make this a lifestyle, remember that in your gut, your body would prefer to absorb, utilize, use phytosterol than cholesterol. When I mean use now, I mean use in digestion, use in absorption. And so when you have less, and they compete, that's just like that's a better from diet. Now I'm talking about from diet, because your body will produce the one you need, the one that your body needs to produce hormones. Your body will produce it by itself. Your liver does that job and does it beautifully well. Vitamin D, it will come from there too. But from the dietary source, why don't you reduce animal? So don't ask me what of goat's meat, what of animal. I see people, I have a friend that has a poultry that will say that if you want to eat 20 eggs, you are free. Nobody's going to tell you don't eat 20 eggs. I want your egg now. Oh yeah, fry. I say, see, you are just toasting cholesterol. They say, no, we add garlic. I say, you add what? You add garlic. It doesn't change it though. It doesn't. It's like drinking Coca-Cola and then you now pour water inside. It does not. You just increase the quantity, the volume. You have not reduced the number of sugar inside. If you want to do a reduction, if you were eating 8 cubes of sugar before, you now reduce to 5 or 4 cubes of sugar. That is a reduction. But if you put 8 cubes of sugar inside bowl and pour 1 gallon of water, it is still 8 cubes of sugar that you have had. You have only increased it. You have not reduced. You have diluted it, but you have not reduced the amount of sugar that you have taken. So you should do that. So the next thing you should do, get the cholesterol team. Don't forget to do the test that you should the test that I have recommended that you do. Now, if you have cancer or you have been diagnosed with cancer, I want to just say to you that take advantage of all these things. And then something that you need to avoid, in addition to all that I've said, you need to avoid soy products. You need to avoid it. I'm not going to be able to go into details of all that today, but you need to avoid soy. You need to avoid it. It's very, very important that you avoid soy. Maybe some other time when I'm going to delve into some other types of cancer or cancer in itself, or I'll think about it. I would go into that. So at this time, I want to take some questions. Now. Already rounding off. Let me see. Question. Please, what's your okay, so what happens in leukemia cancer cases? Leukemia is a type of cancer, and can I be able to explain all of that today? You know what? Watch out for the next cancer episode, because there's no way I will talk. I don't want to just talk and not have a conclusion. So let's just leave that. That's a question that I will consider when I'm doing the next episode, live episode. That's a question I'm going to consider, so that I will answer it. Don't worry. I won't be able to finish it today, and I don't want to talk half-half. So let's leave it for the next one. Somebody asked me that is cancer genetic? Cancer is genetic. Yes, I wanted to answer this. Now, remember, I said to you that, sorry, please let me drink water. So, I said to you that abnormal control. In case of cancer, you have what you call abnormal control. Remember that when there is an alteration, we are looking at alterations that are taking place in the cell. Now, when these alterations are taking place in the cell, there is a change in that cellular composition. Like a change, a distortion has taken place. That distortion is what has made it possible for abnormal cells to grow. When that person has a child, they pass down that alteration in their genes to their children. That alteration may become dominant or recessive, depending on the choices and the lifestyle that that child has had or has. For instance, when people come to me and I'm asking, do you have a family history of someone who has had cancer? And they say, yes, my mom had cancer. It already shows that alteration that made it possible for all these defenses not to be able to identify. That alteration has transferred. But it doesn't mean that the child will have cancer. But if the child engages in activities and choices that promotes abnormal cell formation, what happens is that teeny-weeny cell that was recessive is being strengthened and may eventually muster enough courage to reach adjunct cells and organize with them. The same way you want to inspire people to do something. You go and meet them, you say, excuse me, I want you to follow me. Let's go and form this party, or let's go and do this thing. One person say, okay, I'll follow you. Another one say, okay, I'm not following you. You see, those same things that you do to gather people to follow you, to lobby, to have a crowd of people, that same thing happens on cellular levels. A cell, a tissue that becomes uncontrollable and is able to attach and go to the nearest barracks, which is a lymph node, and says, see, I want to form a coup now. We're tired of this system. Everybody march right. Why should we march right? We want to march because that's really what cancer cell. What I'm describing to you, that's really what cancer cell is. Everybody go straight, arrange your line like this. You have a soldier that is marching forth, which are the B and T lymphocytes and the enzymes watching, everybody watching to make sure that everybody's all right. Then some cells begin to think that this guy, I'm going to deal with this guy. I'm going to escape. It means like 3 other cells say, let's escape. Say, okay, how will we do? There are certain things that they begin to observe. They observe that certain foods that you eat will make the soldier, that is the team, the army, will make them to sit down and they will relax. Sugar is one of them. Very high sugary food will make all the cells in the body to begin to hyperact and reduce the immune system, the tolerance, reduce it. Those cells are watching. What do? They find the next time they notice that every Saturday you used to go and eat burger and drink Coke. Then when you finish eating it, everybody is feeling sleepy. What do? They now escape. When they escape from there, they will go and hide first under the radar. They will be watching. So when they hide, maybe the thing comes from the prostate, for instance. They now escape from the prostate. Where is close to the prostate? Either the urethra, which is into the bladder, or the rectum. They now quickly go and attach to the urethra. They are there, the urethra enzymes, those ones are hatched, they are watching. They begin to make friends with some cells. Are you not tired of these military regimes? I'm tired of the regime. Come and join force with us. What has happened? It has spread from one location, it has moved to another location. Within the body, it has relocated to that place. From there, they go and meet the lymph node. Say, Oga, we want to travel from here. We want to travel to the lungs. Can you help us? Say, I cannot help you. They lead down place, go and look for another place, because it is the bloodstream that will carry it from one location and take it to another location. Once they can leave the location where they were and hide to another location and settle into that place, they will go there and go and form new cells. And begin to, when they form those new cells, they begin to attack the good cells. They begin to attack the new cells and begin to spread and begin to grow. Before you know. So when they are moving in the blood, you see when you do an ESR test will detect that something has moved. A tissue from the prostate has moved to the breast, or a tissue from the breast has moved to the lungs. It's that movement pathway. The blood will record it because they must pass through the blood. That's, you see, so when you do that test and you see a high level, it will tell you what quantity, if it's a trailer that moved, or if it is two people that move with their leg, or if it's a keke napep, or if it's okada. You know, I'm using these things to help you understand what I'm saying. You know, the tea is 10,000 naira on discount, 10,000 naira on discount for this month of August. 10,000 for this. After this month, it's back to 25. It sells for 25,000. There are people that bought it 25,000 that are watching now. They are watching now. They are wondering, you didn't give us discount. Well, whenever I'm talking about a particular topic, I always give people an opportunity to take an advantage and to get the benefit. You know, so I want you to take advantage of that. You know, so these cells, and then also too, we have the anti-cancer tea. I could also decide to give the anti-cancer tea also for 10,000 as discount, because I'm talking about cancer. You don't have to have cancer to take it, you know, but it's always, you know, it's something that can protect, you know. So it does the work of going to catch them where they are and destroy the abnormal cells. That's the work of the anti-cancer, destroy the abnormal cells. It helps the body to be more sensitive, you know. So I was explaining to you how that it can just go there, catch it. You know, so when they go, they move to another. So when you do your ESR test will check. There's another test called the CRP, C-reactive protein. C-reactive protein is a higher dimension of test that also helps you to check. That gives you more details. You know, it gives you more details. You understand? And it could be, so I've had someone that has very high level of CRP, and their lymphocytes, their white blood cells were not very high, but very high levels. Because at those times, perhaps the white blood cells, the neutrophils, the basophils, they were not, you know, maybe there were some dietary things or stress. You can imagine a situation where somebody is, you know, one of the, I mentioned to you that one of the things that can cause a break in defense is the enemy within. The enemy within is the stress. Emotional stress can bring you down. Emotional stress that comes from relationship, that comes from heartache, that comes from marriages, or, you know, your relationship. Those things can really affect you to the point where a cell can begin to misbehave. And that's why it's always good that, you know, you take inventory of your emotions and identify. Some days ago, I posted online, I said, take inventory of your emotions. You must take inventory of your emotions. Take inventory of people around you. Take inventory of how much you have, how much access you have given to them, how much power and influence you have made them to have over you. You need to do that so that you don't break down you could be eating well, your lymphocytes could be doing well, your enzymes could be well, but the enemy within, which is your emotions. Your pancreas is an emotional organ. Your heart is an emotional organ. Your uterus is an emotional organ. You see, your liver gone is emotional. Your intestines are emotional. That's why when you are very sad, you may not have appetite. Your stomach will be tight. You know, some people say they eat, they overeat, You know, the emotions, they play a key part. So you need to. Okay, so it cannot be gotten from any of the shopping malls or pharmacy yet. Not yet. We're working on all those distribution networks, but not yet. So it's right now strictly by pre-order. You can drop your number, my team will reach out to you. We'll have people in Lagos, we have people in Abuja, we have people in Delta State, from
Isoko, they can send to you, so from Abuja you can get, but we can send to you anywhere you are. And this 10,000 does not include the courier charge, please. That's just the cost of the tea. And it's just for this month. And I advise you get it because it's very loaded in phytosterol. So I think I've answered many of the questions here. Any other question? Going. We'll have 15 minutes more to wrap up. Daniela Davis, you want the tea, okay? Bukola, you want the tea. Okay. Okay. So thank you so much for logging into this meeting today. I'm sure you have had a wonderful time. I'm sure you have learned on the body defenses, the immune system, the enzymes. Oh yes, I wanted to give you home remedy. Thank God I didn't round up before telling you. So there's something I want you to do. I already told you about sweet potatoes. Yes, I told you about sweet potato. Then also now that we have so that is something to add. This is not a treatment. You don't go and say it's not treatment. I don't give free treatment for cancer related issues. Anybody that knows will tell you that. So but this is something that you can add to your diet. Add a lot of sugar cane, especially for the men. Add sugar cane to your diet. Eat sugar cane. You can get an extractor to juice the sugar cane because of the sharp water. If you can get a glass of sugar cane to drink, it's always good. The sugar in sugar cane is simple fructose sugar, and it will not cause your sugar level to spike, even if you are diabetic. Even though it doesn't cause your sugar level to spike, so I would encourage you to take sugar cane. That's one thing I want to leave you with. And then don't forget that I said to supply your body with plenty of potassium. I want you to take a lot of purple sweet potatoes, and if you can get cocoyam, beautiful, add cocoyam to your diet, and you thank me. So I'll see you on the 19th. I'm trying to read a message here. Okay, thank you. Yeah, okay, thank you very much. Awesome show. I need for me to hear. Thank you. So I will see you on the 19th, and by God's grace, we will have bigger and better audience, and then our technical issues will not. God will help us to be more proactive, and I apologize for those slight hiccups from my team. But thank you in all. I want to say thank you for logging in. Have a good evening. Enjoy your weekend. Sleep well, eat well. I'll see you on the 19th by God's grace. God bless you. Bye.